Welcome. I'm Julie Thompson, Executive Director of pac-tv, and today we're hosting a COVID-19 update for the town of Kingston. We'll hold these forums every Tuesday and Friday this week, and then starting next week on Fridays at 10:30. Watch in Kingston on Comcast Channel 15 and Verizon 42, or watch online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, please email them to kingstoninfo@pactv.org. And for forum replay schedule and additional Kingston meeting coverage, please visit pactv.org/Kingston. Today's participants include Brad Norman, the Director of Facilities, Mark Douglas, Fire Chief, and of course, Josh Warren, who is the Chair of the Board of Selectmen. Long weekend, and my brain is mush. Take it away, Josh.
Julie, we've been doing this for so long. I'm gonna start cutting or stop cutting you slack when you forget my name. No, in all seriousness, thank you guys for continuing to support these forums. As you said, next week we'll start transitioning to once a week, and certainly, if necessary, we can increase the frequency again. But it looks like numbers are trending in the right direction, not just for Kingston but for the Commonwealth. Yesterday, the Department of Public Health announced that there were 7,594 confirmed positive cases of COVID-19 in Plymouth County. And that was an increase of 35 from the previous day's count. I could look back at the data and let you know exactly when we had an increase that was that small in Plymouth County. But in recent memory, we certainly haven't. Our numbers have been increasing locally at a much faster rate. So the slower rate for the increase is certainly what we've all been hoping for and waiting for, and let's hope that it continues to go in that direction. As of yesterday, the town's total number of confirmed positive cases remained at 85. We did not see any increase to those numbers over the weekend, and of those 85, 46 are coming from one facility. So it seems like throughout the town as a whole, there's a pretty good handle on the spread. So again, that has a lot to do with residents making smart, responsible decisions when they're going out, maintaining good hygiene with their hand washing, and of course, continuing to wear face masks, as we're all now required to per the governor's order. So just one other quick announcement on the governor's order before we turn it over to Brad and Mark. So in addition to releasing its plan for reopening the Commonwealth, which is available at mass.gov/reopening, the Baker-Polito administration has issued a safer at home advisory. And I just want to make sure that residents know that that's out there. And we've included that in the daily letters for the last week or so. Those guidelines have replaced the stay at home advisory, which was previously issued by the Baker-Polito administration and DPH. So these new guidelines are in line with their efforts to reopen the state, reopen the economy, give folks a little bit more, access to outdoor sports and parks and playgrounds and things like that, while also continuing to combat COVID-19. Because even though the numbers are trending in the right direction, it's still out there. We're still seeing increases. Unfortunately, it's still claiming a number of lives for Massachusetts residents. So this safer at home advisory, again, replaces the previous stay at home advisory. And I anticipate that will be linked on the town's website sometime this morning. Those guidelines will be available on the COVID-19 page. So with that, I want to turn it over to Mark and Brad. Mark and Brad are Kingston faces. I'm sure folks recognize them from around town. And they are working on a task force to safely and responsibly reopen the town of Kingston. So, Mark, I guess the first question will be for you. Can you just give us an overview of what it is that the task force is focusing on?
Sure. The goal of the task force is reopening town buildings and restoring services in a manner that ensures the safety and security of our employees as well as the public alike. That will be accomplished through planning and the cooperation of the employees in implementing the plan that the task force came up with, I should say. Keep in mind for folks, it's not one thing at a time. It's many things being done simultaneously. Our priorities or focuses, if you will, public buildings, the town hall has been our first priority to restore town business. That takes a considerable amount of work in terms of the physical aspects, which I'm sure Brad will allude to in a couple of minutes. The goal there is to return the employees in advance of the public, and then shortly thereafter, return the public to the building with some guidelines. In regards to the COA, I'll go through a couple of them. Uh, Returning to full staff, they're at full staff now. We expect transportation to be restored fairly shortly. I'm hoping no later than June 8th, frankly. In terms of the library, we're assisting in the planning of curbside service, and their employees should return this week. Recreation, uh, the priority is Grays Beach, getting that open, working with Sue Woodworth on that. And then she's moving on to trying to plan some summer programs. And many other departments, police, fire, highway, water, sewer, COA, have remained open for various services throughout this pandemic. So what we are going to continue to do as early as this afternoon at 1 is continue our work and hopefully be as expedient as we can in getting the town offices open.
Great, thank you for that. And I know there's certainly a tremendous amount of pressure on you and other members of the task force because one, I mean, folks are anxious to get back into their offices. Folks are anxious to get back to the beach to continue doing things that they would be doing. If COVID-19 wasn't the reality that we're all facing. But in addition to that, you guys are front and center concerned about the health and welfare of employees and members of the public. So I certainly appreciate all of the work that's been going into this. And I know, just from being in the townhouse yesterday prior to the Memorial Day celebrations or rather observations, it's a very different looking building. And I know Brad will speak to that. The townhouse, I think when folks return to their offices and when folks return to do business, they will see a number of changes. It's much appreciated as a board member and a resident that you guys have been doing that work. Now, can you tell us who else is on the task force with you and Brad?
Sure. One thing to mention, if you don't mind, Josh, relative to what you just said, the governor, or the state, I should say, issued guidance on the 18th, and there was some expectation out there that on the 18th would be ready to go. It was difficult, frankly, and not to divert any responsibility, certainly, but it was difficult to be ready with plans when the guidance was issued on the 18th. So we've moved as quickly as we can to accomplish what we saw under those guidelines and hit the dates. So on the task force is myself, Fire Chief and Emergency Management Director, Deputy Chief Hatch, Deputy Emergency Management Director and Deputy Fire Chief, Health Agent Arthur Boyle, Human Resources Manager Tina Betty, Facilities Manager Brad, who's with us today, and Head Custodian, and what's very important is Chris Woods, also representing the Kingston Town Employees Union. It was super important to have a member of the union or a union representative on this task force. The employees obviously have to both feel and be safe as they return to work and as they interact with the public. And based on all of our discussions and the goals we've set, Brad has done a fantastic job at getting the buildings physically ready for the employees to re-enter very shortly. So it's our hope certainly that they both feel physically safe or are physically safe and feel safe as they interact with each other and then move forward to interact with the public.
Great. And I'm glad you mentioned that about the 18th. I know I was receiving emails and text messages from folks during the governor's address asking when certain things would open. And I understand that, again, folks are anxious to get back to, some sense of normalcy. But it really is, making sure that this is a very deliberate, planned approach that takes into account all sorts of different factors relating to the virus and how it spreads. And I think it's also worth mentioning as well. Much of the guidance that came out gave dates relating to when things could open, not necessarily when things had to open. Is that correct?
Definitely, yeah. There's no mandate that anyone had to open anything at any particular time. It's the allowance that it could be opened at that particular time. That said, we're certainly not in any way dragging our feet in getting these things done. For example, Sue Woodworth and Recreation and making sure that beach is open. Several things are involved, including briefing her lifeguards and establishing rules for the bathrooms and the courts that have kind of some fuzzy restrictions. The state has said in many cases that you can do and can't do this. I won't say that some of the things conflict, but some of them certainly are difficult to enforce. So those are all things that we've considered as we've discussed the guidance that was issued on the 18th.
Great, great. And Brad, I'm going to ask a couple of questions of you.
Okay.
So, in addition to having a very clear knowledge of the physical layouts of all of our buildings, just by nature of being the facilities manager, you also have a professional background that lends itself to this sort of work. Can you just tell us a little bit about what you've done in the past that really is coming into play now as you support this task force in reopening buildings and facilities to the public?
Sure, Josh. For 23 years, I was an employee with the in the health field in environmental management. I was an environmental manager at Massachusetts General Hospital and Shriners Hospital, as well as the environmental services department head at the Shriners Hospital for Children. Um, At Massachusetts General Hospital, I work closely with the Director of Infection Control, Maureen Spencer. And at Shriners Hospital, I work closely with the Director of Infection Control, Joan Weber. At Shriners, I was I was on the Hospital Infection Control Committee. It was hospital-wide and worked very closely with Joan and the committee. We developed strategies to keep all viruses and infections from spreading throughout the hospital. I was also the manager of emergency preparedness. I was the Shriners Hospital lead instructor for all hospital employees, that's all including doctors, nurses, etc., for emergency management. And I was also helped working with me on that was the infection control part of it. So I've been involved in infection control for many years.
No, it's interesting to hear that background because it sounds like the containment issues or the challenges, although the steps procedures may be very similar, that's dealing with a virus that may be confined to one building or to one section of a building. How does that relate, or how are the challenges different? I guess when you've got something like COVID that has a factor like community spread and it's not under one roof. It's not even in one zip code.
Everything that I did at the hospital, I remember thinking this when this all happened. Everything I did on a hospital level was contained. Whatever it was, if there was a train accident and we had a large amount of people coming in the hospital, all hands on deck, or if we had an outbreak of MRSA, whatever it was always contained. The thing that is so difficult for all of us has been for me as well is this is worldwide. This is not contained. This is new to everybody, including when you listen to the health doctors, the professionals. So it is very difficult to deal with. So what you try to do is make those places that people are going to as safe as possible for them. If they're going out and in this whole world, they are being exposed, the key is to, when they come to you where you are, is to make that place as safe as possible. And as you can see in our entire, you go to the supermarket, you go anywhere, it's happening.
Yeah, and your fingerprints are all over the town's response to this from day one, and I think back 2 months ago now, there was a concern with the municipal gas pumps and making sure that those were as sterile as possible for police and fire who may use those to gas up vehicles, and those became I guess, a touch point that you were then responsible for in terms of sterilizing on a scheduled basis. You provided rubber gloves. I'm sure you guys just saw
Yeah, I
salt
love
in the
it.
background.
I love it. There you go.
Um,
Boom.
I think we're now 80 days without daycare and a haircut, clearly. So he's letting us do our work, which is great. But yeah, and it was really impressive. There were very few municipal buildings or properties in Kingston that didn't have some level of control measures that you would put in place. And it goes back to what you said. When you're dealing with something that is not just community wide or regional but worldwide, um, I guess the focus shifts to controlling where people are going and what falls under your purview. So
Mhm.
just wanted to thank you for that. Can you tell folks that are watching from home who may not have had the opportunity that I had this weekend to walk through the townhouse? When you look at a building like the townhouse, what have you done to start preparing for staff returning and to get the building ready to resume services to the public?
Well, first of all, the staff has been coming in and out ever since the beginning of the virus because a portion of the people are working at home, but there's many of us that have to go to the town hall to do our jobs. So the town hall is disinfected as all the other buildings in town on a daily basis. Touch points are not what you think they are. Everybody thinks the door handle, but it's also the framework people touch around the house, I mean, around the buildings. So we have been focusing. So at the town hall, all of the employees, including the highway department, wastewater, et cetera, I have made and gave, had made and gave 2 cloth washable masks to all workers. Each office has their own bottles of hospital grade disinfectant. And with a pop-up paper towel that's going in there now when the general public comes back, so they can disinfect as any general public comes in to use as a disinfectant. And it is a hospital grade disinfectant. We have 2.5 gallons at every location in town to fill those bottles so that every office and every space, every vehicle has the disinfectant spray. Many of them also have hand sanitizers, and we are ready to go with hand sanitizers in every office to be used by every employee in the town. As I said, all touch points are disinfected every day. Anticipating the public entering the building, we have one-way signs, one person in an elevator signs, one person on the stair signs, anything that can't give you over 6 foot distancing. We've installed permanent glass shields in the tax collector clerk, assessor's health office, and the inspector's office. The employees at the town hall have been a part of all of this in helping me accomplish this. And they've really been terrific, giving us ideas and telling us what's going to make them feel safe. Chris Woods, who was mentioned before, who represents the union, walked through every building and met with every person, and we discussed with them what would make them feel safe. That's basically it. We also have portable screens. If you went to the election, you saw the portable screens protecting the workers there and protecting the people at the election. And we're ready to go and back up Mark and the emergency management team.
And shifting gears a little, for other buildings that provide direct services to the public, what's been done to modify those spaces or to make them conducive to, I guess, serving the public, given that this is still going to be the reality for potentially many, many months to come?
I'll give you one that was kind of fun to do. We call it the ice cream store. The highway department it will have a large amount of people starting to come there June 1st for transfer station stickers. So between the staff there and myself, we came up with the idea of taking out the screen and putting in a mailbox type plexiglass so that people will not be coming in the building. They will be going to the door, to the window. There'll be two windows that they can use, and that's where they will pick up their new sticker for their transfer station, which I thought was a good idea. They're putting out signs there that will say to call first. So basically, they'll call, drop it at the window, and then they'll go pick it up at the window, process it, leave it at the window, call them and tell them to come on and get it. They'll probably see them drop it at the window and won't have to call. But that is one unique. The issue when we move forward is every building is different. Every building is a different percent of people. You know, there's hundreds in one building when there's 50 in another. The entrances are different. We're looking at making even more changes later, automatic doors so you don't have to touch them, canopies for street side pickup at the library, and we're trying to do everything we can and do it as economically as we can.
And I'm glad you mentioned doing things economically, because I think one of the other things that might be worth talking about is a lot of these expenses will be reimbursable through the CARES Act, and we had Commissioner Dan Pilata with us 2 weeks ago to discuss what is and is not a reimbursable expense for a municipality to apply for. And as you're saying, things like screen window that now becomes a service window, and I know just from having been in the building, the cones that delineate traffic patterns, things like that. These are all expenses that the town did not anticipate that we are incurring as a result of COVID-19 that will indeed be refundable, or we can apply for those funds through Plymouth County in their administration of the CARES Act. And if my memory serves me, it's just under $600,000 that we can apply for in the Plymouth County phase one of CARES Act administration. Is that correct?
That's correct.
Okay.
Sorry.
No, that's okay. I'm happy to see that all of the things that we need to be doing are at least in this sense being supported by both the federal government and our county government as they administer those funds. Mark, I'm gonna bounce it back over to you, and just quick question: what has been reopened? And you said this earlier with curbside pickup and things like that, but what do you see as being the next few properties to reopen? And I know we chatted prior to hopping on pac-tv about what some of those dates might look like, and when those may be, at least a soft idea of when those will be made available to the public.
Sure, Josh. The plan is as we have it written, and as I said at one today, we're going to discuss the final plan in terms of dates. But the COA, for example, has their staff back. We're hoping to restore transportation to the general elderly public no later than June 8th. I'm hoping for earlier than that, to be honest. The library will begin curbside pickup this week. Their staff is back this week. Town hall, my hopes is June 1st for staff, June 8th for the public. Recreation staff, some are back this week. All will be back next week, June 1. We're targeting Grays Beach as soon as possible. That's going to be a discussion at a majority of our meeting today will be to get that up and running. We realize it's going to be warm. The original target date for that was June 1, but obviously we realize that given that it's warm, we'll see if we can get it open a little earlier for the public. So those are just some of the dates. Obviously, your public safety has remained open. Ourselves, police, highway department, water, sewer, everybody in those departments has remained working with the exception of office staff. And their office staffs, water specific, should be back June 1. So those are just some of the dates that we have on the calendar for those things to happen.
Great. And I know from chatting with Paula Rossi-Clapp last week, early on, when the COA closed its doors to the public and the library as well had to discontinue services as we otherwise knew them, there was a concern with a number of seniors who were at home and really running out of material to read. And in chatting with Paula last week, it sounds like as they continue meal deliveries and services like that, they're also working with the library to find out a way to facilitate curbside pickup as well. So it might be possible for a senior to put a book on hold and actually have one of the COA drivers who's out and about delivering meals pick that up curbside from the library and then facilitate that delivery. So, it's just another example of Kingston's department heads working collaboratively to solve problems and meet the evolving needs of our residents. So I was really happy to hear that. Clearly the reopening task force that you're both a part of is focused on Kingston's properties, Kingston's buildings. Um, who's working with local businesses, and who's going to be facilitating that aspect of it, answering those questions as the Baker Polito administration provides guidance, not just for phase one, but for subsequent phases for things like barbershops, restaurants, bowling alleys, so on and so forth.
Those required approvals will be, of course, through the Board of Health. Many of those things are just in terms of statutory approvals, those have to be done by the BOH. And Arthur Boyle is doing a great job down there. He's one super busy guy, I'll tell you that. But many of those things are just simply going to have to go through them. On the fire side or emergency management side, Deputy Hatch will be working with anyone who needs the input of the emergency management folks to reopen a business. Um, Deputy Hatch typically does fire prevention as part of his duties, and to incorporate that is a natural workflow. Really, that's what he does. So between him and Arthur, they should be able to answer any of the questions that need to be answered relative to business reopenings. And if neither one of them can, and we need to bring other department heads such as building into the mix, then we certainly do that on a case by case basis.
Great, and I'm just pulling it up now. If anybody is watching that does own a business in Kingston or that has questions relating to their reopening or their favorite hair salons reopening, the number for Board of Health, just so that it's out there as well, is 781-585-0503. I know their phones have been ringing off the hook, especially as guidance has come down from the state in terms of who is cleared to open. Even in anticipation of announcements being made by the state, Arthur and Kathy Ivers, who's in that office as well, have been receiving a flurry of calls. But as you said, that really is the appropriate department to reach out to if it's regarding a business or a property that is not town owned. And Julie, I'm not sure, have any questions come in since we've hopped on?
No, I don't have one yet. I do have a question though. Your real estate and personal property taxes are still due on June 1st, which is next Monday. Is that correct?
I believe so.
Okay.
And questions relating to that, we can certainly direct folks to the collector's office, and I'll pull that number up as well, just so that that's out there. The number there, if I can find it on their webpage, is 781-585-0507. Well, Brad and Mark, I really appreciate you both coming on today. I think, and Mark, you've said this time and time again, for the last 70 plus days as we've been working on Kingston's response to the COVID-19 pandemic. Communication really is going to be key. And I think, just having seen Brad's work in and around town, the signage is going up. Folks really should continue to monitor the town's website, www.kingstonmass.org. And just as we were posting announcements of when buildings were being closed, as we get dates, we'll be posting updates on when buildings will be reopened, when services will resume. And I think I can say this, for both of you as well. We just really ask that members of the public continue to be patient as we try to do this in a safe and responsible way. But also, as dates do become available for proposed openings and reopenings, those are subject to change. And we're working with the guidance that we're being given as quickly as we can. As Mark said, there's certainly no one dragging their feet on this. We just want to make sure that we get it right, so that all the great work that residents have done over the last 70 plus days to mitigate the spread of COVID-19 in the Kingston community isn't reversed by a rash decision to reopen something prematurely, or to not really take into consideration, as you both are, all of the different safety precautions and needs that exist in this new era that we're living in. So, with that, I don't know if either of you have any parting words, or if we can just send it back over to Julie.
I just would like to say thank you very much to the public. Most of the public certainly has been extremely understanding in the course of this. Most of them have certainly been respectful in terms of the way they've treated our employees, fire, police, whomever it may be, the town offices that are working from home and trying really hard to help them. It's amazing work that some of our department has done when you look at planning, building. They're working on projects that, such as Amazon and other projects that are beneficial to the town, and they're doing it um, in many cases from home through Zoom meetings and meetings that don't allow the normal interaction with people. It can be very difficult to get them accomplished, and so many of them are doing it just so well every single day. And I would like to say personally, thank you for that. They've worked very hard. Those of us that are in the emergency business are used to working through emergencies and times like that, and most of these people are not, and they've been doing an absolutely stellar job for us. I just would like to say personally, thank you. It means the world to me that they've given us the support that we've hoped for, and I hope that we can do the same and return them to their offices both safely and so that they feel safe.
Brad, anything else?
Mark couldn't have said it better.
Well, thank you both, of course, for joining us, but more importantly, thank you for all the great work that you're doing right now to make sure that again, things are able to reopen safely, responsibly, and as expeditiously as possible. So, many thanks, and Julie, that'll do it for us.
Okay, thank you so much. And if you notice, we date stamp every single one of these that we film, and this is Tuesday the 26th. We have 6 more days in May, and then we're on to June, and hopefully another phase will go on in June. We look forward, I'm sure the residents of Kingston look forward to visiting the townhouse and seeing all the accommodations that you've made to make it a more safe place for both the public and the employees who work there. If you want to watch this or any of the Kingston forums again, please visit pac-tv.org/Kingston. We wish you a wonderful, safe week, and we will see you again Friday at 10:30. From PAC-TV, this is Julie signing off.